So the crisis response unit will respond to people who are in mental health crisis, experiencing significant distress, but we will also go out to support carers of those people who might be struggling. So even if that person isn't in a significant amount of distress or what people would consider a mental health crisis, but the carer is struggling significantly, we will go out to support carers and loved ones as well. So the main bulk of our referrals come from the ambulance service and from the mental health hub. So paramedics who are on scene with patients will call us if they need our support. The mental health clinicians in the ambulance service control room will also call us for advice or support if they've spoken to somebody or somebody's carer, family, loved one, and they have concerns for somebody but that person doesn't need an ambulance. We'll take referrals from the mental health hub to avoid the ambulance service being contacted. So if someone's unable to keep themselves safe or we're worried about them, they've not been answering the phone, we need to do a cold call. So we get most of our referrals from both of those services. So people that are quite distressed, people that want to harm themselves, people that might be considering harming other people, somebody experiencing psychosis, somebody experiencing a relapse of an existing mental health illness, somebody whose mental health has generally deteriorated and they no longer feel able to keep themselves or other people safe. We can go to the patient's home, we can go to the home of family, friends, we can go to a public place, so whether they're at their workplace or they're in another area in public. We go to care homes, supported living environments, we can go anywhere. So typically we will go and we'll introduce ourselves, we'll seek their consent, we'll make sure that it's a safe environment for them to be assessed in, make sure there's people there that they can rely on if they need to or people that they trust. We will seek to complete a full assessment of their needs, and we're an assessment service, so we will refer on to other services such as the crisis teams, crisis houses, for hospital admission, to community mental health services or any other sector support that they need. Sometimes when we arrive things can be slightly chaotic and it can be quite busy for that person, they might be quite distressed, so we'll seek to de-escalate the situation as best we can in order to offer them the support that they need. In our partnership with EMAS, we were hoping to provide a timelier response for mental health for people in mental health crisis. Mental health deserves the same speed of response as physical health. So what we hope to do is respond in a way that allows the ambulance service to get back out on the road and seeing patients with those physical health ailments that they can support, while providing the tailored support to the individuals that we know are in mental health crisis. We hope to alleviate the pressure on A&E and services like that, because we do know that there's a lot of pressure in those environments.